It's Columbia Morning at KFRU. This is March, third day into March. March happens to be Colon Cancer Awareness Month, and so we have in the studio with me Dr. Erik Grossmann with Columbia Surgical Associates, which is an affiliate of MU Healthcare, and we're going to talk about something that he is passionate about, and that is colon cancer. Good morning, doctor. How are you?
Great. Thanks for having me on.
So, what do you think is the reaction when somebody finds out that you're a doctor who deals with colorectal cancer and some of the other things that you do in your daily work?
Well, a very common question I get is, why did you choose this job? And the truth is, one of the reasons I chose this job is that I want to take care of patients with cancer, and colorectal cancer is the second leading cause of cancer death in America. About 140,000 Americans this year will get colorectal cancer, and the real tragedy is that the majority of those cancers could have absolutely have been prevented if those people had gotten colorectal cancer screening.
We'll talk about what the screenings are in just a moment. So is there, once that let's say that somebody says, well, okay, I'll get the screening, but I want to try to live a life where I would avoid developing that. How much of what happens with colon cancer is inherited, and how much of it is lifestyle?
Yeah, so only about 5% of colon cancers are related to a genetic problem, and 75% of people who get colon cancers have no family history. So the truth is, we're all at risk of colorectal cancer, even if we have no family history. Now, there are some risk factors that we can control. So obesity puts you at high risk, physical inactivity puts you at risk, a diet heavy in red meat and low on fruits and vegetables put you at risk, smoking puts you at risk, heavy alcohol puts you at risk. But here's the truth. If you get your screening, you will decrease your chance of cancer by 60 or 70%.
Because they find polyps early.
Right. So most colon cancers are going to start as a polyp or a non-cancerous growth. Half of us will get a polyp in our colon at some point in our life, and polyps have no symptoms. You won't know you have a polyp unless you get screened. And if we remove that polyp, we prevent your cancer. So unlike some other screening tests that are just looking for cancer, screening for colorectal cancer isn't just looking, it's actually preventing the cancer.
Men or women are equal as far as most susceptible to getting colon cancer.
Yeah, so it turns out because women live a little bit longer, there's a little bit of difference in the incidence. Men are a little bit more likely to get colon cancer than women are, but it's pretty close.
About how young, have you seen someone with colon cancer?
Yeah, so personally, I have seen patients in their 20s, and there have even been reports of teenagers with colon cancer, although that gets really, really rare. So most patients that have colon cancer are 50 or older. However, we're seeing a slight increase in the incidence of colon cancer between 40 and 50, and that's why the American Cancer Society recently came out and said we probably should start screening people at about 45. And it's important to know screening means people with no symptoms. If you have symptoms, bleeding, change in your bowel habits, something else concerning, it doesn't matter what age you are. Those people need to be examined right away. But if you have no symptoms, even if you have no family history, at 45, you need to start talking to your doctor about what your options are.
Well, first of all, I want people to hear what you said were the symptoms that would say immediate screening, do something immediate. And you said those were bleeding and change in bowel symptoms.
Those would be the main ones, belly pain, sudden unexpected weight loss. Those are all things that you need to go talk to your doctor and see, do you need a study at any age?
We're talking with Dr. Erik Grossmann with Columbia Surgical Associates, and they're affiliated with MU Healthcare, about colon cancer awareness, because this is Colon Cancer Awareness Month. The screenings, there are several different ways of screening. First of all, I grew up in a time where 50 was the year, and everybody always said one of the things you do when you're 50 is you start getting AARP information, and then you also get a colonoscopy.
Yeah, I turned 50 this week, and I just got my AARP card. But I have a family history of colon polyps. I've already had several colonoscopies myself. The first thing I would say is not everybody needs a colonoscopy, but if you do, it's really not a big deal. You go in, you take a great nap, it's over, and you go on with your day.
I've said the same thing. I said, it's extremely restful.
Now, the other thing that is great is in the last few years, there have been some great alternative tests developed. Particularly, there's a test that looks for abnormal DNA in stool samples. That is a reasonable test for certain patients. So you can talk to your doctor. You may have some alternatives to colonoscopy. But even if you need a colonoscopy, it just really turns out not to be that big a deal.
And again, I want to emphasize, I said 50, but the doctor is saying that new guidelines would say that should start at 45, even for people who are asymptomatic.
Yeah. Now, one of the challenges is that recommendation just came out, and currently insurance companies aren't mandated to pay for screening tests younger than 50. So I think one of the reasons the American Cancer Society made that guideline change is to encourage insurance companies to change. So I would just say between 45 and 50, you need to go talk to your doctor, see what your options are. Certainly by age 50, insurance companies pay for screening. Going to be a little bit of struggle for a while until those insurance companies change. But most of us believe we probably should start before 50.
Is this one of those that if you live long enough, the chances of you having a colon cancer increases, kind of like, prostate cancer for men?
Yes, so the longer you live, the greater the chance that you will develop a polyp. And if you have polyps, a small percentage of those can turn into cancers. But if you get your proper screening, you'll decrease that chance by 60-70%.
One other question that I have, many people also say somewhat jokingly, but also know that for some it's kind of true, that the preparation to have a colonoscopy is much worse than the colonoscopy. What do you say to those people who say, oh, I don't want to have to drink all of this stuff? I mean, you are asked to drink a huge amount of ill-flavored water.
That is true. And if somebody can invent a good way to do that, they'll become very famous and very rich. So I tell people, do what I do, rent a bunch of movies and stay home and try to make a party of it. The day before is the tough part. The test itself is pretty easy.
I got to say, I've come to work the day before and survived. It's okay. I mean, you can do that. It really isn't that bad. People exaggerate, I think, the discomfort of that. Or it's not really discomfort either. It's just they exaggerate the preparation part.
It's certainly very inconvenient, but the truth is most patients would only need to do a test like that maybe every 5 to 10 years. So your day will get disrupted for about a day and a half of your life every 5 to 10 years, and you can decrease your chance of the second leading cause of cancer.
What do you want to end with? What do you want to reemphasize?
I just want to reemphasize that if you're 45 years or older, you are at risk, whether you've known that or not. You need to talk to your doctor. What are your options? And certainly if you're having any kind of concerning symptoms, doesn't matter what age you are, talk to your doctor and have them find out what the problem is.
As the doctor said, this is one that you can detect early, and the treatments early are very successful. You can deal with this. Just need to be able to get the test, and that's all that stands between you and maybe have peace of mind that you don't have colon cancer, or detect it early so something can be done. Doctor, thank you.
Yes, I appreciate it very much.
Dr. Erik Grossmann from Columbia Surgical Associates with affiliate of MU Healthcare has been our guest. This is KFRU.